but in that he has a concept called AIDA. So when you're writing marketing material, you want to use AIDA. And what does that stand for? The A is for attention. Okay, so look, we even have the word up here, attention. Okay, attention mothers and grandmothers. We've grabbed their attention. If you're a mother or a grandmother and you're flipping through a program full of logos and you're looking for your grandchild and you read this, okay, which is going to take you less than 1 second to do, it's at least going to grab your attention to continue reading down at least through the ad. Okay, so attention. What does the I stand for? The I is for interest. Okay, we're piquing their interest. Do you suffer with hip pain and stiffness after sitting for long periods? Okay, we're piquing their interest. The D, AID, is for desire. Okay, and with our headline here, we want to hit on their desire. So if you suffer with hip pain and stiffness after you sit for long periods of time, what are you desiring? Okay, and I got this headline just from reading through literally thousands of patient testimonials, hundreds literally on hip pain. Okay, so those that suffer with hip pain and stiffness, what are they looking to do? They want to turn back the clock on their hip pain, and that may be colloquial here to Central Pennsylvania, but there's a word, phrase, or terminology in your area that you could say the same exact thing. So go to top3hip.com for your free video called 3 Steps to Turn Back the Clock on hip pain and arthritis. Okay? Or it might be hip pain and stiffness, but in our case, the video that I have on top3hip.com is called 3 Steps to Turn Back the Clock on hip pain and arthritis. Okay, so that is our D, desire. We're hitting that desire button. Okay, and the A, which is our fifth step overall, is action. Okay, so that's we're doing our call to action very specifically. So it's like a go there now. All right. So we have attention mothers and grandmothers aged 35 to 55 who subscribe to Blue Cross or Blue Shield. Do you suffer with hip pain and stiffness after sitting for long periods? If this fits you, then you may qualify for a free video. Go to top3hip.com for your free video, 3 Steps to Turn Back the Clock on hip pain and arthritis. Okay? And usually we want to have some sort of expiration date. If you're using expiration date in there so they act now, that's the 5th step, is the call to action now. All right? In this case, in a program, we're not going to include that in because once the season's over, they're done. All right? So that is the difference between direct response marketing and branding. Can you see for yourself, even though you might not be a mother or grandmother between the ages of 35 to 55, can you see for yourself that if that were you, you would have somebody very specific raising their hand, and that would be the reader in this case, coming to you for physical therapy, and that's the person that you're looking to attract. Okay, so we don't want to attract everybody, right? We're not looking to attract Gateway because we're not allowed to treat them because they can only be seen in the hospital, right? So we're not looking to attract absolutely everybody. We're looking for a very specific niche for people that are going to respect you for your clinical expertise. They're going to appreciate the care you give them. They're more likely to refer other people that they know that they're socially connected to that are similar to them, right? So we want to attract somebody very, very niched and specific for something that we specialize in this case, the relief of hip pain and stiffness or hip osteoarthritis. And avoiding, total hip replacement and things along those lines. So we got very niche with our direct response marketing piece. You can apply this not just in programs. You can apply it to your patient newsletter. You can apply it to your physician mailings and your physician newsletter. Have you ever had a physician reach out to you for a free report or a free DVD or a free video? We have in our clinic, and it's great to receive communication from physician for them reaching for information. Do you think when they do that they're much more likely to refer a patient to you? The answer is yes. Okay, and they can actually help you do this if you hit, on the attention, interest, desire, action those items in that Gary Halbert book, the Boron Letters, if you use that and you apply that and your direct response marketing, you're going to get a much better result and return on your marketing dollars that you've invested in a physician newsletter or a patient newsletter. Okay, so that's direct response marketing versus branding, and I hope this has convinced you that if you're going to do anything in the future with marketing your private PT practice, you put it in writing, you use direct mail or you use your email, and that you use direct response marketing. You can also use it in email content, email newsletters, your e-zines, your faxes, anything along those lines, and especially when you're going to the general public, you can use direct response marketing. You can use direct response marketing when you're looking to attract staff. Okay, we just put an ad in JOSPT and JMMT to hire 2 full-time physical therapists, and we used a direct response marketing concept in that as well, where we're having very specific physical therapists who meet our 5 clinical predictor rules for somebody who would work here. So again, we're matching the language with our target audience, but we have a very specific therapist that we want to apply. We don't want every physical therapist to apply. If they've been doing wound care for 15 years, they should keep doing wound care. They're not going to help us out in our outpatient orthopedic clinic. Same thing for if it's somebody who specializes in gait training for or people with prosthetics. You're not going to see a large population of that here. Same thing with geriatrics, same thing with pediatrics. We're looking to attract a very specific therapist. With direct response marketing, we can do just that. There is no logo in our direct response marketing ad in JOSPT and JMMT. But I hope that gives you a good example of what direct response marketing can do for you, and I hope you apply it. Next thing I want to talk about are the 2 books that I'm reading this month. The first one is Scientific Advertising by Claude Hopkins. This is public domain, so it was written in 1923. You can access it online. You can also shoot me an email at chad.madden@maddenpt.com or chad@breakthroughmarketingpt.com, and I will be happy to forward a free PDF of this book. And you're a scientist. You have a bachelor's degree or a master's degree or a doctorate degree in science, and you're a scientist in the clinic. You should also be a scientist with your marketing. And Claude Hopkins, as I said, this is almost 100 years old. He wrote this book, Scientific Advertising, and it is phenomenal because the truths that he wrote about back then still apply today. And there was just one example that I wanted to read for you. On page 30. In the same way, it is found that an offer limited to a certain class of people is far more effective than a general offer. So even going back to our direct response marketing ad, we've made a very limited offer to a certain class of people, mothers and grandmothers aged 35 to 55 who are Blue Cross or Blue Shield subscribers. Those who are entitled to any seeming advantage will go a long way not to lose that advantage. Oh, you're talking to me. That's very specific to me. I'm more likely to reach out for your offer. So that's just one example that's a 2-liner from Scientific Advertising. Claude Hopkins, free. Shoot me an email and I'll get you a free copy. The other book is the Boron Letters. It's written by Gary Halbert, who many consider the greatest copywriter of all time. The Boron Letters consist of 25 letters that Gary wrote to his son, Bond, while he was in prison. Gary, being in prison, wrote them to his son Bond. They have just loads and loads of wisdom, not only on copywriting and how to do effective marketing, but also on how to live life. And there are absolutely great things in there. So there are 2 books that I'm reading right now that you should take a look at as well. Next time we're going to talk about this question, and the question is, if you had to double your practice in the next 12 months for whatever reason, what would you do? I have done this. In 1 year, grew my practice over 100%, so doubled my practice in a year. And the following adjacent year, I did the same exact thing. So I went 400% in 24 months, and then I completed a full 600% growth within 30 months. And we still continue to grow today. and I'll share with you what I did during that 30 months of absolutely fantastic growth.